So thank you very much for staying to listen to me speak. The build-up of today, I hope, matches what I'm about to talk to you about. So, and if it doesn't, I think there's only one person that you need to feed back to about raising hype. Right, okay, I'm going to try and fit quite a lot into the next 20-ish minutes. So, if there's something in here that I don't cover and you want to talk to me about, I will be here afterwards. So please come talk to me, email me, my details are in here. So just come and have a conversation with me about it. What I'm about to share with you is quite big and it's really hard to talk about it in 20 minutes. So, and I'm going to use some film. So the first film, I'll introduce who I am in a sec, but this is the first film just to give you a flavour of what we're trying to achieve in Future Focused Finance.
Future Focused Finance sets out a vision for NHS Finance to aspire to over the next 5 years. Starting with a series of launch events in early 2014, staff across every part of the NHS have been involved in sharing their ideas about how we can help create a successful and sustainable NHS. To do this, we need everyone to have the skills, methods and opportunities to influence the provision of high-quality patient services. It is about making people count. Everyone working in NHS Finance, those we work with to deliver services, and the patients that use them. There has been tremendous support from the leaders of the finance community. Over 150 finance directors have signed declarations setting out how they and their teams will contribute to achieving the aims of Future Focused Finance. The number of people getting involved is growing every day. There are now over 2,000 people registered on the community website, including nurses, doctors, AHPs and management colleagues. On the website, you'll get the latest news, find out about events and be able to connect with others involved with future-focused finance around the country. Individual finance teams are also running their own development events to link in with the themes of future-focused finance. Helping all this are the value makers. This is a network of finance and clinical staff committed to helping their organisations deliver best value for patients. Launched at an event in July, the Value Makers are already making a tangible contribution in raising the profile of future-focused finance and helping their teams connect with the national work that is going on. That national work was shaped by you. You told us that you wanted future-focused finance to find and spread best practice, to provide practical tools that can be used to help clinicians improve patient services, to help finance leaders make their teams a great place to work. The 6 action areas are now beginning to deliver on this. Caroline Clark's action area on best possible value is creating a set of methodologies that will help improve decision-making around service design. The work on efficient systems and processes provides benchmarks and best practice to improve your performance. Sanjay Agrawal, a consultant in respiratory and intensive care, is leading on how to engage frontline clinical teams, directly connecting the work of NHS Finance with the design and delivery of patient care. And the Great Place to Work assessments, part of Kathy Kennedy's action area, have highlighted the things finance directors should be focusing on in developing their teams. The 6 heads of the profession also remain closely involved and are planning to establish a foundation to act as a vehicle to steer and sustain the aims and ambitions of future-focused finance for years to come. The journey to make people count is set to continue, and everyone is invited to get involved.
So just to give you a flavour of what it is that we're trying to achieve, and it's always better when other people say it, I think, and it's quite empowering working with the finance profession. So I'm Sam Sherrington and I am a nurse. I am not an accountant, you know, despite any of the things that may have been said about my drinking ability, my care and compassion are what matters the most. So I got asked to go and work with the finance leadership last year, and I've always worked in nursing, 20 years in nursing, love it, live it, patient care, fantastic, working with families. And they were launching Future Focus Finance, and they wanted help and support in how to make this change happen. So they knew what they needed to do. It was actually getting it done that they were thinking, how are we going to achieve this? So as Ashley's already talked about, we've got 15,000 finance staff, but it might start with them, but actually it's more about everybody. And as Ashley quite rightly says, patients included. So they didn't know what to call me, which is where the title comes from. And they wanted to call me, and this is quite poignant really for the whole thing that I'm going to share with you. They wanted to call me Head of Fluffy Stuff. So, and I think the reason for that is because they wanted me to get involved in everything that wasn't professional and technical. They wanted me to lead things around transformation and culture and people and conversations and patients and, you know, the things that actually they find as a community quite tricky or hasn't normally been within their gift to get on and deliver. So I'm in NHS England. I am on Twitter. Anybody who's on Twitter or would like to learn how to tweet, come see me. We'll learn. Somebody taught me. This lady here taught me a lot about Twitter. So, you know, just come and join our community online. And NHS FFF account is on there as well. And email me. So if anything today touches anything that you are working on, whether you're an industry partner, whether you know we are all patients, you know, families, carers, whatever, I'd love to hear from you. So as Head of Fluffy Stuff, one of the things that's been said to me is that I've swapped bed sheets for spreadsheets, which I thought was quite good. But the thing that they do notice is I'm much more hands-on. And I have suggested holding hands. And the reason that I love this picture is obviously the method, obviously the words are amazing. Yes, that's what we're trying to do together rather than individually. But I have suggested holding hands. I've even suggested hugging at work. So, and then they're like, Sam, we're finance people. We don't do things like that. But actually, there's been a slow burn and a slow change. They're not started holding my hand yet, but I think they will. And I'm very positive and optimistic about it. So yeah, this is our motto. So when we've been engaging with people, this is the thing that we're trying to do. Yes, we'd like people to be their best. Yes, we want the talent to do amazingly. Yes, we need the best people in the NHS to lead this, but we need to do it together. And that togetherness is with all of you here too. They're with the 300 nurses I spoke to in Harrogate. They're with the finance department that I went to speak to in Cheltenham, and so on. So it is my absolute pleasure to work with these individuals, the 6 heads of the finance profession. Now, before our Health and Social Care Act and my word, before we had kind of a bitty kind of disparity across the NHS, there was one leader of finance profession. Now there are 6, and actually we could argue there are more than that. Leaders at all levels, I would say. The best leaders are probably those people who aren't on this picture. But these 6 individuals, powerful, credible, really driven to transformation. They absolutely know that transactional is dead. Transformation is the new way that we need to do this. They recognise that finance is a really, really well placed to drive this, to lead it and to mobilise it. They are interested in people's future, not just now, next week, you know, kind of what's this going to look like for the finance profession 5 years and beyond. So they are very strategic in their thinking, and it's wonderful to work with them, and they do laugh a lot, and they don't wear grey suits all the time. So, you know, it's completely changed my way of thinking in finance. And this is a wish list that we came up with from our engagement events. So we engaged with clinicians and patients, with finance staff, with managers, all across various different health economies. And this is our wish list. And I don't think this is too big. And I don't think there's things on here that we can't achieve together. So, you know, the focus on value as well as cost. Well, actually, people do need to know the cost of things first to understand the value. But let's talk about value. You know, simplified approaches. It is really complicated. Finance is very complicated, and I think they do it on purpose, especially for nurses like me. And if Sanjay was here, he gets people to talk about brackets. So you know the brackets on your spreadsheets, are the brackets good or not good? Are you bothered? you know, kind of, and it's different in different organisations, and we could spend 20 minutes talking about brackets, but the point is that variation makes it complicated, and we want simplified approaches. Yes, we've got amazing finance professions, but we do need it to be much more simple, so we can engage, so we can come closer, we can lean into it, we can smell it and feel it and touch it. And we can make this work philosophy. I remember a number of finance directors that I've worked with, you know, and I'm ENTP for anybody who's done Myers-Briggs, you know. I scare introverts to death, so I would go straight into their office, and they couldn't even look at me. They would look out at the window, at the floor. There was one finance director who had one chair in his office, and it always had papers on. I would move them, right? And he didn't want me to, and I would sit down. So, you know, and actually, thank goodness I've met the most amazing finance director since. But, you know, we can make this work. I need to have an open door to go in to tell you my idea. If you then say, Sam, no, we can't afford it, or no, then actually I want somebody to say, I like the idea, we can make this work, and this is potentially how. So this is kind of what the programme structure looks like. Very simple. We've basically got the 6 leaders. These are 6 SROs. There's me, David, and Camilla, and that's it. That's your England team. Yeah, so we've got 12 individuals who do this as well as doing everything else, and then we've got our 3 support team here. So our delivery mechanism is through all of you. It's through our networks, it's through our delivery group members, it's through our value makers, and it's through our finance educators. So it's really important. Now, I've not got time to tell you about this whole programme, so I'm going to tell you a little bit about close partnering, and that for me is the most important cog in this wheel, because it's about enabling that close partnering between finance and the clinical world. I said to these nurses in Harrogate, if I could just bring you 1% nearer to the finance, 1%, all of you, that would have such an amazing impact. If I could get you to have a conversation in the same space, a shared understanding, a knowingness, a shared outcome or a purpose, so that actually patients were openly discussed. You know, I asked finance team, hands up if you honestly think about the patient every time you make a decision. Some finance staff feel so far away from patients, they can't even put that into their mindset, and that's a shame. So let me tell you about close partnering. Firstly, it does involve everybody. Future Focus Finance isn't about finance. Finance is a lever. Yeah, it is everybody. So patients like Ashley and others, communities, clinicians, individuals, finance teams, and taxpayers. So that's all of us. So, and what does it look like? So the dots and bubbles diagram is what we talk about. The dots and bubbles is the delivery mechanism. So each of those bubbles is something that we're going to do. It's an action, it's a programme, it's a piece of work that we're going to achieve together. So close partnering. We started talking about waste, and I guess this is quite pertinent for the discussion here. And it was amazing because we had Glenn at one of our delivery groups, and it was wonderful to have that debate with GS1 in the room. And waste, I think, is something that as clinicians is really, really high on our agenda. Yeah, it is something that we see every day, with something that just annoys us, either wasted time, wasted resources, a waste of patient journey, and. So there is something about having a conversation with clinicians that doesn't go like this. I need to tell you about SFIs. That's how I was taught when I became budget manager. You, Sam, need to learn about SFIs. If they'd have said to me, or CIP, gosh, that's even worse. If they'd have said to me, Sam, I want to talk to you about waste and how we can engage your staff, your teams in waste discussions and removing waste out of our system, well, I'm listening straight away. So the Don Berwick work, fantastic, and I know it's in the US, but there are parallels. So we're looking at some of these mechanisms as a kind of starter for our conversations around waste. What is it that we can release, and what is it that we can find by removing some waste in our systems? And clinicians see it, and all the time. Nurses, doctors, allied health professionals, healthcare scientists, doctors, dentists, everybody. And they feel powerless to do anything about it. This is where we need finance to open those doors widely and say, come in and tell me. Come in and tell me how. And then helpfully, the Academy of Royal Colleges produced this document, and it's a great read, and it's not very big. And, you know, one doctor's waste is another patient's delay. And you can say that for any clinical person. So it is a delay, it's a shame, it's a waste, it doesn't need to happen. You wouldn't want it for you, you wouldn't want it for your loved ones and your family members. We don't want it either. So actually, let's promote the value and get rid of some of that waste for efficiency. And it's a necessity, it is absolutely. So how we're going to do all this, loads to achieve. We've got the whole of NHS England to think about, England in NHS rather than NHS England, and we need help. So Sanjay decided that we would have a group called Finance Educators. So we asked the finance function, on top of their massive jobs that they do already, to come forward and volunteer to be finance educators. So we sat there thinking, will anyone apply? Anyway, they did. 136 finance educators came forward and said, in my organisation, I want to champion finance, I want to educate others, and the finance educators look outward from finance. They are responsible for educating the rest of their organisation across boundaries, you know, into health economies, you know, doing this together. And this is a finance educator session. They're playing a game, because playing and fun, enjoyment, holding hands, hugging, you know, it helps you learn, it helps you embed, it helps things move faster. So this is one of the finance educator sessions that happened on Monday. And they are playing a board game. It's an operating game. I don't know whether you've heard about it. It's really fun. You either make the trust bankrupt or you make it in surplus, and it's great. So, and they're playing very competitively, and that's great. That's a really fantastic way to engage clinicians in those tough decisions that have just been talked about. Okay, cancer money. I sit in a CCG 1 day a week. It's fascinating, and we have some of those really tough decisions. We bring patients in actually to help us make those decisions. So, finance educators. And then we've got people like Ashley. So I've just uploaded this picture. And, you know, I know by how many people were talking to Ashley afterwards, what an amazing patient champion. Don't you want to just clone him and take him everywhere with you? I have suggested that we get like a little tie so I can tie myself to him, but I just don't think his family would be too happy about that. So Ashley is our biggest advocate. By far, he's sold Future Focus Finance further and faster than we could ever imagine in our own professional organisation and groups, because as a patient, his mechanism for delivery, and you've heard it, you've met him, is just so powerful, and he's developing a network. So those patients we've met on our journey around the country, we're going to network them together. We're going to give them to finance directors and say, if you're redesigning things, if you're changing things, if you're looking at efficiencies and improvement, use this individual, let them help you shape some of those tough decisions. And he is quite fantastic. We've also done some media and awareness things as well. And the patient conversations, the transcripts, look out for those because they are quite fantastic. Now, on this journey with finance, I don't know whether it's a good thing or not, but Roy Lilly, anybody of you read Roy Lilly's blog? Yeah, quick show of hands, okay. So I'm in Brighton one morning and I get a text to say, this is like 6:30, whatever time it comes out, it's earlier doors, isn't it? And somebody texts me to say, what have you got on your feet? So, and then I read this. So, counting on you, Roy Lilly now calls me Imelda Marcos of the NHS. So I'm not sure whether I'm pleased or not that I've got a nickname, but he is quite fantastic. And this was probably one of our best publicities. So we've got patients like Ashley, and then we've got people like Roy Lilly championing our Future Focus Finance. Now, the blog is sarcastic, and you'd expect that from Roy. It's challenging, it challenges us, and it's a funny read. He talks about my footwear. But the point is, actually, he delivered Future Focus Finance instantly to a huge audience of NHS managers, and that was great for us. And you need to really galvanise individuals like Roy, and he's a great critical friend. So he talks about some of the things that we're trying to do, and he's going, you don't want to do that, it's rubbish, do this. So, you know, it's good to get those individuals on board. So, Something else that we've been doing, a toolkit. So I'm one of those individuals that I think don't drown us in products in the NHS because we've got policies, we've got papers, we've got this, we've got that, we've got the other. Please don't design a toolkit. So I'm stood here saying we're launching a toolkit, and it does feel a little bit tough, that, but this one, I promise you, is very good. So one of the reasons that I really like this is because it's been designed by Michael West. So for those of you who haven't read anything around Michael West's work, I would go and have a look. He's at the University of Lancaster. He's a fellow at the King's Fund. And what the toolkit does, it enables conversations, productive conversations between clinical people and finance. So lots of people have said to me, Sam, I don't know where to start. Where do I start on our conversation? How do I get clinicians to come through my door? How do I get people to even get interested in finance? This toolkit will help you. It will help you think about the relationship. Michael West talks about reflexivity. There's a quiz in there as well. So there's lots of things to get that interaction started and actually produce some of the productivity. And value makers. So we've got about 170 value makers. They are individual, patient, clinical finance champions all across England. They are there now, and would be brilliant. They're just change champions by nature. They're enthusiasts. They're our ambassadors for Future Focus Finance. And if you've not met a value maker, I nearly brought one with me, but if you've not met a value maker, just have a look on Twitter. They're all over Twitter. They send each other beautiful messages every day like this. Okay, so they start the day with a big smile and sunshine, and they are amazing individuals. They are directors of finance, they're payment clerks, they're people across the whole sector, and I would really encourage you to go meet a value maker, and we're growing that community. Please come and join us. Our website is where most of the stuff happens, because you can imagine there's only 3 of us, and everything is posted on there. How do you get finance professionals who are risk averse to come and blog in an open space about some of the trials and tribulations that they're having, and or celebrate some of the successes that they're having? And that's quite tricky. We've built the website for people to use, for you to join, so that you can have a look at the conversations. And this is some of the Twitter activity. So this is from Monday. 96 people, 700 odd tweets, reaching 1 million impressions. And leaders, and I'm going to whiz through this because I want to show you a film. So leaders at the front. So this is Sanjay leading and encouraging finance professionals to say, what are you doing for Change Day? What are you doing for NHS Change Day? What is your pledge? What will you go and do? And obviously Sanjay's making his pledge here. Okay, let me show you this film. It's a gentleman who won an award for innovation, and he's a clinical person, he's a pharmacist, and he won a finance award for making a small change in his organisation. So let him tell you about it.
Hello, my name's Rob Duncombe, and I'm the Director of Pharmacy at the Christie NHS Foundation Trust in Manchester.
Okay, Rob, could you tell me a little bit about your project which led you to winning the awards that we can see there?
Yeah, this project started around about the autumn of 2013, when we started to recognise that more and more patients are on very high cost oral chemotherapeutic agents, and over the past few years there's been a gradual move away from IV therapies to oral therapies, and also with some of the cancers we now treat, they become more of a chronic disease rather than an acute disease. So conventionally you'd give a patient maybe 3 to 6 cycles of IV chemotherapy, the patient would come in, have the treatment and go home. With the oral therapies, patients are on these treatments maybe for a year or 2 years, and as their condition and disease stabilises, the patients come back to us less frequently, particularly if some of the patients come from long distances away. Therefore, we're finding that in a number of cases, patients were quite rightly being given prescriptions for 2 or 3 months' worth of treatment, and these treatments were sometimes more than £6,000 in terms of value of drug. And unfortunately, during the next couple of months, their condition either changed, they may have been entered into a clinical trial, they may have been admitted to a hospital for another reason, or their disease may have progressed. And therefore we were finding at times patients or their relatives were coming back to us with bags of medication which the patient had unused, which had a large value associated with them. And so what we introduced was a scheme whereby the clinician would issue a prescription for say 2 to 3 months of high cost therapy, but we, through our pharmacy technicians, would be phoning those patients on a monthly basis, firstly checking how they were, going onto the hospital pathology systems to see how the patient's blood results were, and only at that point in time then initiating a further supply of medication to the patient. And what we found was over the course of a year, and obviously at the Christie we have a large number of patients who have entered into this cyclical scheme, we saved over £200,000 in terms of drug costs just by reducing the amount of supply. We also were able to ensure that no patient actually had more than probably 1 week's worth of safety stock, which again resulted in another saving for us. And we're also finding on probably 2 or 3 patients a month in whom we're actually making a clinical intervention with those patients, or talking to the patients, we're finding that they're having problems with their condition, things have changed, and through that we're able then to go directly to their consultant and bring forward their outpatient appointment. So I think this scheme that we've introduced works every way possible. In terms financially, it works very well for both ourselves and our commissioners, but it also works very well for the patients because having that additional contact with a member of the clinical team during the course of the treatment, and also for the consultants or the staff of the trust, because again it enables the consultants actually to reduce the number of follow-up attendances in assurance that a member of the pharmacy team is in regular contact with their patient.
So not to underplay Rob's project, please go and have a look at it at the Christie, it's amazing. But basically, a conversation with a healthcare professional to a patient reduced their drug bill by £200,000 a year. Now, you know, I'm learning to add up by numbers, but you know that's replicable absolutely across many places. The drugs might not be as high cost, I agree, but you know that's definitely something that you can lift and shift. Great place to work. I just want to mention this because it's been picked up a little bit already today. So who wouldn't want to work at the best workplace on earth? So, you know, I am absolutely sure that you've worked in places that you know you get up and you're buzzy and you kind of, you know, you're happy at work, you do your best, you thrive, you develop, you grow, and you just love it. It becomes part of, those work people become your family, don't they? And then I've also worked at places, and I'm sure I'd share this with you, but you know, that I wouldn't ever want to get out of bed to go and work there, and it is really tough. And I do get emails from people saying the environment that they're working with in the NHS is toxic, and they are really, really unhappy, and unhappiness, unhappy patients, unhappy outcomes, and so on. Now, we looked at this Harvest Business Review as a kind of basis for principles, and I don't know about you, but I really like the last one, right? So the last one says there are no stupid rules. Now, you know, there are so many internal rules, isn't there, in the NHS that you just think, where did they come from? Oh, you can't go to that meeting, Sam, because you're a nurse. Or you can't go to that meeting, Sam, because you're not senior enough. Or you can't be privy to that information because it's not appropriate. You know, and. So you can see it, can't you? And you can feel it. These are the stupid rules that we make up inside our own kind of spheres of power, in our own silly little bubbles of, you know. So the stupid rules we can definitely just get rid of, I think, pretty immediately, but that takes the people individually and the bravery to make that happen. The other things I think also are achievable in the NHS. We can make this the best workplace on earth. And for some people, that is already happening today, yesterday, tomorrow. For other people, we're a long way from that. So, great place to work. This is kind of what we're trying to achieve. We've got 11 work streams in Great Place to Work, and you can see by the love heart, bring your love to work. This is what we're trying to achieve through all of those work streams, and that's how we benchmark against some of those principles. And one of the things we found, we did some team assessments with Great Place to Work Institute. There's an institute about Great Place to Work. And guess what? They're great people to work with. They're amazing. So Great Place to Work Institute, we did a survey with 20 pilot sites, acute trusts, mental health trusts, commission organisations, people like the Business Services Authority and so on. And we had the survey results fed back to us. And these are 3 critical, what they call moving the dial. So these things, we could move things immediately. Okay. So this is the stuff that we can absolutely change the here and now. It says, finance staff have the chance to spend time at places where care is delivered. 64% favourable. So where finance staff have the opportunity to actually see, smell, touch, involve themselves in patient care, the happiness, the improvement went up exponentially in their Great Place to Work. So they loved being nearer to patient care. Yesterday, someone told me that their finance department had just been moved into a building probably 4 miles away from where any care was delivered. And the isolation of that team is going to be incredible. So how do we make sure that you, decision makers, finance teams, stay closer to care? And we can definitely achieve that. The next one, I am allowed to use social media to help me collaborate and share good practice. Only 57%, said positively that they are allowed to do that. That's amazing. We're in 2015. So, reach in your pockets and pull out your phones. It is there. They are not allowed to. There is policy amongst policy. I go back to the stupid rules bit, So there's just, why wouldn't you want to network and learn? And the last thing, just kills me. My finance team regularly celebrates success, 49%. Why not? Why not? Have a thank you. Thank you, you did a great job. Thank you. You celebrate, last month you did this and it was brilliant, or yesterday you did this and that was fantastic too. We really need to celebrate the best bits about finance. I went to one organisation and a finance member of staff said to me, I got put forward for Employee of the Year, I think, Employee of the Year. And I was like, oh, that's amazing. She said, yeah, I didn't win it because the CEO thought that we should have a patient-facing clinical person as our Employee of the Year. And I was like, what? So, how does that feel? How did we make that finance staff member feel in terms of value and their contribution to the NHS? That's horrendous. So, we need to nurture and celebrate the brilliant stuff that they are doing. They are spending this 107 billion fantastically well with us. All right, we're spending too much. But, let's look at all the great stuff that they are doing. And this is some more ways for you to get involved. So I'm going to show you one last film and then I'm done. Please do connect to Future Focus Finance. It is a programme that's here to stay. It's got the backing of some fabulous leaders, and we are connecting to thousands and thousands of people across England and abroad, and in Scotland. We've got value makers in Scotland now as well. So anyway, let me show you this. Thank you.
God knows what is hiding in those weak and drunken hearts. Guess he kissed the girls and made them cry, those hard-faced queens of misadventure. God knows what is hiding in those weak and sunken eyes. Fiery throngs of muted angels, giving love but getting nothing back. Oh, people, help the people. And if you're homesick, give me your hand and I'll hold it. People, help the people. Nothing will drag you down. Oh, and if I had to bring
Thank you very much.